Perfect. Yep. So just get started now. Perfect. Hi, everyone. Thanks so much for being here. My name is Tina Ho. I'm a facial plastic surgeon in the Philadelphia area. I'm just going to share in the group chat here my Instagram handle. This is a great way if you want to see more day to day, a little more perspective on my life as a surgeon, also my work as well. And I'm happy to, help answer questions here. I usually don't like to talk more than 20 to 30 minutes. And afterwards, open up to any questions, since I feel like that's most helpful. So happy to talk about, my life as a plastic surgeon, my training, my practice. I have a son who's now 1 year old. So also happy to share my perspective as a female surgeon and also as a mom surgeon. So I have East Coast roots. I grew up in the suburbs of Philadelphia and then moved to the Virginia suburbs. Also went to William & Mary for undergrad and then University of Virginia for medical school. And then just wanted to ask real quick, your students, what kind of educational level are you all at?
We're actually a mix of college and high school students.
College and
So,
high school. Okay, perfect. Thank you. And so I went to University of Virginia for medical school, and going through that process, I had my own childhood surgeries that influenced me to consider a career in plastic surgery. I had a large nevus that I was born with, think of like a large mole that needed to be removed because it could have been potentially cancerous later in life. So I had about 10 reconstructive surgeries between birth and fourth grade. I saw early on the immediate positive impact my surgeon had on me, and I wanted to be in that similar role for my patients. Really enjoyed, doing math and science and excelled in those classes, going through high school and college. In college, I majored in neuroscience, and then I also had the time in my schedule to major in international relations as well. I highly recommend, hopefully this is a theme that is prevalent through my talk here. If you have the time for it, you know, pick a different major, take that gap year off, take the time to really explore other interests you have. Just because with medicine, it's so much time, so much, effort, finances, personal sacrifice involved, and it's always going to be there. It's a very long journey. It's often a lonely journey too. Your career will always be there, but if you have room in your schedule, it's always easy to major in a science major, but to be pre-med and do something non-science, I think that's great. And two, whether it's that or doing certain extracurricular activities or working before you go to medical school or traveling before medical school, that will give you a different perspective and make you even a more balanced, physician and a better physician for your patients too. In college, I really enjoyed service activities, had an opportunity to go on a couple of medical mission trips to Costa Rica and Nicaragua. I really highly recommend that kind of experience too, because not only you're immersing yourself in medicine, but you appreciate more the idea of of service. And two, I think it's important to experience and see other cultures and then come back and appreciate more what you have, here as an American, growing up here. I think that's really important. And so, always was interested in plastic surgery, and this is like general plastic surgery, body plastic surgery, going into medical school. I was a bit intimidated because plastic surgery is one of the most competitive surgical subspecialties to apply for. And I found early on in med school, I was very average. There's no longer getting A's in classes. So that just, hit me hard with the perspective of, I wasn't the best test taker. Studying more wasn't going to necessarily get me the better grades. So, I was lucky to feel and be balanced to medical school. Just making sure you study a lot, but also, having those outlets to have some self care too at the same time. It wasn't really until medical school that I learned more about otolaryngology, or ENT, ear, nose, and throat. And then my favorite core rotation in third year medical school was general surgery. I then chose plastic surgery and ENT to rotate on as my surgical subspecialties, and really enjoyed both of those a lot. I did see, though, ENT seemed more like my calling, where I enjoyed being a head and neck specialist, like having that focus on this part of the body where the anatomy is so intricate. You have your cranial nerves, you have all these small vessels, and it was really neat to see myself as a specialist where you have a good balance of clinic and operating. Think you're in the clinic 2 to 3 days a week. You can do a lot of procedures in the clinic, and then also surgery. You can be operating 2 to 3 days a week, but also a lot of it can be outpatient too. So having a good work-life balance. At the same time, I saw there was an opportunity that you could do facial plastic surgery through ENT in case if I wanted to be a plastic surgeon still. And then I felt like I really clicked with my mentors in the ENT department, the residents and attendings. They seemed really nice, approachable, super smart, and also seemed to be balanced from a work, personal life perspective. So ENT as well is super competitive. I think it's much more competitive now than since I applied. Um, for me, I think being average in my class just a testament of hard work, doing research, being lucky to have relationships and good recommendation letters, and so I applied broadly to ENT. Never thought I'd end up in the Midwest for training, but a lot of the big programs, kind of like the one program in town. A lot of big programs are from the Midwest. So I was lucky to match, my first choice of University of Kansas in Kansas City. Hadn't been there before my interview trip, but basically fell in love with the program when I interviewed there. So it was a great clinical program where I rotated in different environments: academic, children's hospital, VA, private practice, and two, they had a strong facial plastics program. Throughout my residency training, so that was 5 years of residency, and they did 1 year of fellowship. And just think, that may sound like a lot after your med school, but minimum residency is 3 years. And if you want to do, um, you know, cardiology or GI, after doing medicine or peds, you're gonna do 3 years and then at least another 3 years. So it adds up anyway. So doing 6 years total doesn't seem like that much. ENT, I tried to be as well as open minded as possible, but just naturally, facial plastics is what still drew me, what I wanted to do ultimately. Um, with facial plastic surgery, I've learned too, like for that niche of medicine, it might not necessarily be only because you're most interested in that aspect of medicine, but also if a certain field suits your personality characteristics. So you've probably heard or seen certain stereotypes like emergency medicine, maybe those physicians are a little more ADD because they enjoy, a different type of patient that walks in through the door each time. Um, they might say they have the best work life balance because they don't have to take call. As soon as they're done their shift, they're done. With plastic surgeons, we are meticulous, we're OCD, we're perfectionists. I don't mind suturing. And as a surgeon, I like that immediate sense of gratification where I can be decisive to provide immediate result for my patient, which is awesome. And so with ENT, if I think I would have been fairly happy as a general ENT surgeon. Just think with ENT that the bread and butter cases are like getting your tonsils out, your adenoids out, ear tubes, other ear surgeries, doing head and neck surgeries like taking your thyroid out, parotid gland or other salivary tumors, head and neck oncology. If you're into following certain musicians like Adele, being a voice specialist, especially just in that's laryngology, or sinus surgery is also a part of bread and butter ENT. So for me, I then went to Chicago where I did a 1 year fellowship in facial plastic and reconstructive surgery. It was more on the cosmetic side. Within facial plastics, there's a wide spectrum of what you can or can't do. So even, my training, there are certain procedures or disease process that I am not an expert in that I would refer to someone else. On the reconstructive side, you have skin cancer reconstruction. So that's like if you've heard of Mohs surgery, Mohs surgeon is a dermatologist surgeon who goes in and takes out a skin cancer. They can take it out in pieces and they kind of compare it under a microscope to leave behind the smallest defect. And then if they don't feel comfortable to close that defect, then they can uh, ask for the help of a surgeon like myself to repair that defect same day or in a couple days. If the defect is much bigger, say someone who's a big time smoker, drank alcohol, and they have a big cancer on their tongue or in their jaw. Um, a head and neck oncology surgeon may remove it out. They could do the reconstruction, or a facial plastic surgeon can do the reconstruction too. We call this like a free flap, where you can take tissue from your arm, like soft tissue plus bone, um, skin, and then you reconnect the local arteries and veins together. It's a crazy, at the same time. Also, from a reconstructive standpoint, congenital conditions. So, facial plastic surgeons can help repair conditions like cleft lip, cleft palate. Just know there are certain conditions or surgeries like that where historically general plastic surgeons cover it. So, if you're more interested in craniofacial congenital conditions, then it might be best to go down the general surgery, plastic surgery route. But still, in some areas of the country, it's facial plastic surgeons who take on those cases. Hemangiomas, like other vascular lesions, can be taken care of. And then facial trauma is also under the reconstructive side. So if someone breaks their nose, another bone in their face, they have a laceration, facial plastic surgeons can help take care of those issues. And then finally, another niche in the reconstructive side is facial paralysis. So if patients have a paralyzed face due to an injury, maybe they had a tumor that needs to be removed or as a complication from a surgery, then facial plastic surgeons can help do non-surgical or surgical procedures to restore more symmetry to the face, maybe even more movement to the face, which is really cool. On the cosmetic side, so you think for facial rejuvenation, there's non-surgical and surgical procedures. On the non-surgical side, you have your Botox to minimize wrinkles in the face, filler injections to improve volume, definition in the face, laser resurfacing, and just think, facial plastic surgery, it's a fluid field too, where other surgeons may have overlap, or other physicians. So dermatologists will also do a lot of these non-surgical procedures. On the surgical side, there's rhinoplasty. You can perform surgery to help improve the outer appearance of the nose as well as to improve the breathing function of the nose. It's my favorite surgical procedure, but it's also very difficult, just because a millimeter change can make a big difference in the nose as well as elsewhere in the face. Um, in addition, there's eyelid surgery, or there's upper or lower eyelid surgery to help create more youthful eyelids. Asian eyelid surgery or double eyelid surgery. I have patients who seek this out with me to create a crease in their eyelids that they don't have. Facelift, neck lift, those help to rejuvenate the face in aging patients. Brow lift, in my younger patients, a lot who want to achieve more youthfulness with a more contoured face. You might have seen hashtags like snatch jawline, but buccal fat removal, take out some fat here to make the cheeks less rounded, liposuction here to help improve contour in the neck. So really in facial plastic surgery, there's a lot just within that spectrum. In my practice, I'm currently in private practice and I mostly focus on the cosmetic side. That's just how it has naturally evolved right now. I do enjoy and miss the reconstructive side. And right now, so I'm in the clinic, 2 to 3 days a week, kind of like your 8 or 9 to 5 work day, and then operating 2 or so days a week, starting at 7:30 in the morning. I might be done by 3 or 4. My patients usually go home the same day. I only take call for my patients. I don't currently take call in an ER hospital, which is really nice. And so that means I don't round the hospital on weekends. I don't work unless I have a patient with an issue or if I need to see a follow up on my own time. Otherwise, and again, I can help answer questions or talk more about, private practice versus academics. To me, in private practice, the pluses are, you have more control over your own schedule, how you want your practice to be, especially in plastic surgery, like your brand, your marketing, your staff, who you have. And just to clarify, I'm an independent contractor, so I work through two offices, but I don't have my own office yet. And then, what else? Kind of have more control over work-life balance too. Um, those are some of the things, and that I work on, healthier patients. Downsides to being in private practice, you are, especially for me as a plastic surgeon, I'm always on call for my own patients. Yes, there's someone that can cover for me if I'm out of town, but really, like, I don't have, I mean, I could have colleagues, but it's not like, when you're an emergency medicine physician, you're totally off. Or like, say you're a hospitalist, you work through an academic center where you're off too, that someone else is really covering for you. Um, I have to, if I'm not working, I don't make money, so there's some times that challenge too of how much do you take time off or not, even though you have more control of your income, the potential that you could make if you're in private practice. I'm not involved with teaching formally or research, so those downsides too. And then the even if you're in academics or in a hospital, system, yes, you might not have as autonomy or control, say, over your schedule and who you work with, your staff, but sometimes you might be okay with that, to not have as much control or responsibility or hiring and firing employees. There's a headache with that too, right? To manage your business, from that perspective. So I'm just, kind of giving a taste a little bit. Hopefully, this has been helpful with just explaining a little bit my practice and facial plastic surgery. So what I will do is share a couple of cases here, and it's basically just before and after, just to give you more of a glimpse of the spectrum within facial plastic surgery. So. Um, okay, so let's see here. Okay. Just trying to look for. Okay. Okay. And hopefully you all can see this. Let me know if you can't. So this is a lovely patient of mine, where she, underwent a facial rejuvenation procedure with me. She's about 6 months out. The left image is her before and the right image is her after. I guess since we have an audience, does anyone want to chime in either verbally or in the chat of what she may have had done? Any takers? I guess I can't see. I don't know. Michelle, do you see any responses in the chat room or no?
Yeah,
Okay.
someone said fat removal and a buccal fat reduction, neck
Okay.
lifted. Yeah.
Okay. Okay, good. So, my treatment goals are usually to help patients achieve beautiful natural results, but that you can't tell exactly what was done. So what she actually had was the main surgical procedure was eyelid surgery. So upper eyelid surgery. So if you see here on the right side, she has a little bit more heaviness off of her upper eyelids and her eyes pop more. She looks more refreshed. We like to say and think that the eyes usually show the earliest signs of aging. Also, at the same time, I did some cheek filler, gives a little bit of lift, and projection to the cheeks, and some lip filler too. But that, in a way, sometimes the lighting is a little bit off, with the pictures, but it gives an illusion because her eyes look better. She's a little more lifted in the cheeks, that your attention is drawn more there, that you could maybe guess, like, oh, did she have buccal fat removal? Did she have neck surgery? And again, so it's just a nice, natural enhancement. So she also has a reconstructive side, to her history. at 7 days out, I saw her back, I took out her stitches, she was healing just as expected. And then 2 days later, now 9 days out, she texts me in the middle of the night, like I was, just about to go to bed, and says that her dog accidentally bit her in the eyelid, the one eyelid. So, she's waiting in the ER. She has no idea when a plastic surgeon's going to see her. So I ended up just seeing her in the office. Usually when you have a laceration, especially if like an animal, or human is involved, you want to get it cleaned out, as sooner the better, from an infection standpoint. And then you want to also repair it, usually within a 4 to 6 hour window to get the best healing results, with a laceration. So let me see here. Hopefully this will, okay. So this is her at 7 days out, a week out. So this is her with her stitches, and so you can see expected bruising and swelling. That's usually the case from just eyelid surgery. And then let me see here. So this is where she was the night of her trauma. So lucky for her with this laceration on her eyelid that it just opened up her incision. If she actually lost tissue, it'd be a much more difficult, you know, uh, case to handle. I probably would think about just washing her out, maybe not, maybe partially closing, and think about a skin graft at some point to do it, and sooner than later. You don't, in this case, like again, there are certain wounds in the face that you can just let heal by its own, call it secondary intention. But in this case, if you do that, it could start to, what we call it, contract and make it too tight, that like a webbing like kind of result. And then you see here, this is uh, uh, just some additional lacerations on her nose and the medial corner of her eye, which did become an issue, which luckily did resolve on its own. So this is her after her repair, from the laceration repair. So this is before her stitches were taken out, again, like at 2 weeks out. Um, and so this is probably when she was a month out healing. As you can see in the corner of her eye here, it's, kind of looks more prominent. She actually developed webbing. This is just a very difficult area when you have a laceration or you have scarring there, because you it's a so if when a scar heals, it likes to contract, meaning it likes to, every the tissues to come inward. So with that, if you're healing an area that's prone to a lot of tension, it can then contract even more and cause an issue, in this case like a balled up, scar that's webbing. Also too, what I noticed, and I had to go back at her previous pictures, is her left eyelid looks less open, her eye aperture. See, the lid is like closer to the pupil. I was worried at first because I said, "Oh, you look at her before picture, her eye is totally open. Did I cause this from her surgery?" But in actuality, no. And it's what we call ptosis. Ptosis is something that can happen in patients in general. It's a ptosis repair is a surgery that I don't do myself. So just think, you use a plastic surgeon, facial plastic surgeon. I also have overlap with oculoplastic surgeons. Those are surgeons who train to be ophthalmologists, eye surgeons first, and then did a fellowship in just plastic and reconstructive surgery for the eyes. So there, I just didn't learn how to do ptosis repair. There are facial plastic surgeons who do it, but this is something where if she had this in the beginning, a surgeon can repair it to open up her eye aperture more. So with this, I was concerned about these two issues. Luckily, I consulted with a couple of colleagues who said, for the eyelid ptosis, it's probably due to swelling and trauma. It should, you know, resolve on its own, or just give it more time. And same with the webbing, give it more time. She can massage it. You could consider a steroid injection. Um, and then ultimately, this is where she was 6 out. So you can see her ptosis did resolve on its own. And this is, I mean, you can, now that I point out to you, there is something there, but it's much less prominent. And I'm very happy with the results, that she otherwise just looks like she only had eyelid surgery, from her history. And then this is something to take a look to. If you can see, the incision lines are very faint here, but the face heals really well. So even from a laceration standpoint, that she really healed nicely, and the scars, if they heal well, are really faint. Um, and let me show you just a couple more views here, especially if I have some from the side. Let's see here. And then you can see here, this up close, see this her right eyelid and the heaviness there. And now that it's more open, just a little bit of that heaviness taken off, like goes a long way. And see her right eye again, just a little bit taken off, goes a long way um, from a healing standpoint. Okay, so that's a surgical case here. And then, so let's take a look at a non-surgical case. Okay. Okay, so this lovely patient, she's a fitness instructor. She's really fit. She comes to me asking if she would, you know, to pursue non-surgical treatment. So just think Botox and filler, to help make her look a little more refreshed, a little bit younger. What? So let me just throw it out there. Any thoughts on where she had injectable treatments at all, and what type? Just so you can think like where she might have had injections, like what location, whether it was filler and Botox. Any thoughts? And feel free to, you know, respond in the chat too, if anyone has any thoughts.
Yeah, someone in the chat said eyes, outer corners of the eyes, cheekbones or lips, maybe, cheeks. Yeah.
Okay, good. So some jawbone, good. So like a lot of good responses, and you guys are really intuitive already, which is good. And hopefully, and you this can be up for a debate, but hopefully in the right image, you think that she looks not overdone, that she still looks natural. So, I definitely was happy to help pursue treatments to help make her look more rejuvenated. But what I also saw too is that she looks a little strong, like a little harsh on the left side, as if a little masculine. I think part of it is because she's just really fit. So not only did I want to make her look younger, but I wanted to make her look more feminine, like a little softer and more balanced. We think of the ideal youthful female face as one that's more kind of V-shaped, like an inverted pyramid where they have good cheekbone projection and definition, and then it tapers down in the third of the face. So, and I'll show you some images here. So, something she was bothered by, a little bit of actually brow asymmetry, as well as wrinkle lines in her upper third of the face. This only shows one view, but I did do Botox here between the brows, her forehead, and around the eyes. And I did also to lift a little bit of tails to the brows and a little filler to lift the brow on the left side here. So if you look immediately on the right side, you can see this view of just showing the crow's feet, the lines around her eyes are much softer, and that her brows are a little more symmetric. And then looking at her cheeks, I did place some filler in her cheeks. I think I did, 1 to 2 syringes total. Each syringe is only a fifth of a teaspoon of product, but just, to help give a little bit of a lift and a projection to the cheeks. And at the same time, to help with that contrast to her lower face, I did only a syringe to split it across her anterior jawline here. And you'll see in the other views that it just fills it in to make it a little bit smoother. And what I love is actually doing Botox to the masters. Your masseter muscle is this jawline muscle right here. It's involved in eating, your muscle of mastication. It's kind of back here by the angle of your jawline. By injecting Botox here, it can do one of two things. It can help by paralyzing this, atrophying the muscle. So it helps to give you some contour by bringing in this muscle. As you can see how much it jutted out more compared to now it's more tapered in. And then the second thing, and this is how and where I get Botox, is that if you have TMJ pain, like due to grinding your teeth, um, you clenching. First line of management is always a night guard, but by relieving the tension on this muscle, it relieves tension on your joint. And so it can relieve that pain as well. So let's take a look at some other views of her here. see. Let's see. And this is her at baseline. You can see, especially that contrast. You boost the cheeks, you narrow the lower third of the face, and it helps give her more of that inverted pyramid V shape look to her face. Okay. Let me just take a look. And you can see here again, some cheeks, a little more definition, structure, the jawline a little bit smoother. And I'll show you on her right side, it even shows a bit more just with, and then here too, just again, a little bit more here that gives the more of the structure, the cheek, pops out more. And I just like this one oblique view because again, it just helps the cheeks a little more filled in, has more definition. And you just see right here, she didn't need that much. She actually has great jawline definition, but it just helps to, just fill in those areas of depression that are associated with aging. Okay, perfect. So let me stop the share here. So I want to open it up to questions, if that's okay for all of you. And again, if there's not really too much questions, we can always go over another case, but feel free to ask away in anything related to facial plastic surgery or anything work-life balance. I'm an open book. Okay. So how do you find the work-life balance as a parent? It's a great question. So I am still learning and I've learned to take it, one day at a time, day by day. Um, I really am in awe of, I think, moms out there in general ever since I had my son, just because I learned quickly, especially when it comes to like breastfeeding and the amount of time you take care of your baby in the beginning, that I lost a sense of autonomy and independence, right? You now have someone that depends on you. It's just a very different feeling. And, and also to learn too, like not to judge, because every mom or dad's journey is different, how well they cope with their baby, whether or not they want to be a full-time stay-at-home mom or to work, it's all different and relative, right? I also am very in awe of those moms who started having kids during residency. I definitely, don't think I could have done that. I, waited until I didn't get married until right after fellowship. And then, I'm now about 2 years in practice. So it was just last year that we had our son. Um, so yeah, I think part of it is just taking day by day and trying to learn how to, separate when I'm working and when I'm not, which is hard because especially in plastic surgery where I always feel like I need to do something. And I think too, it's important to have a good support system. So my husband, he's working from home. He's able to take care of our son too. Today, for instance, were really challenging. I had a lot of virtual consults and meetings, and I'm here with you guys right now. My husband's with my son. My son was very fussy today, so it was challenging where I kind of had to leave a crying baby, to come up here and do some of my virtual consults. But if I think you have a good support system, whether it's for your future family or for yourself in your journey in medicine, that's really important. Make sure you have that support system. And for the women out there, don't feel like we always have that time, that clock clip, ticking against us, but always feel like it's okay. It's your time whenever you want to have child. We have options now like IVF, that you can wait if needed, but and it's okay to figure out your timing when you should get married, when you should have a kid. Those personal life decisions, because a lot of it too is it's out of your control when those things happen versus becoming a physician. I had a rhinoplasty 2 years ago. I feel like I can't breathe as well as I used to. Have you had any patients present something like this after their rhinoplasty? Definitely. So it's always good to, if you can, I recommend going back to your previous surgeon if you feel comfortable seeing them again so they can take a look and make sure is this due to the surgery or not. For me, as an ENT trained facial plastic surgeon, I have an inherent understanding of knowing both form and function to the nose. And that means I have a thorough understanding of, you know, anatomic issues that can contribute to nasal breathing issues and how to make it better. I feel like we have that as an advantage compared to general plastic surgeons. And so often I have patients, even they just come in for cosmetic rhinoplasty, and they're like, oh, I don't really have too much breathing issues. And then I see like an issue, like a deviated septum, that at the time I take the time to just correct that as well as surgery. And then they feel like, oh, wow, I'm breathing better after surgery. So it's gratifying too to be able to help improve from a quality of life standpoint, their nasal breathing. What can you do in high school to better your chances of getting into medicine? Um, so I think, there's textbook answers of, you make sure you have experiences that show that you're interested in medicine. I know it's tough right now with COVID, but being able to, if you can, shadow local doctors. I think engaging in medical organizations like this is awesome. But also, too, yes, there are certain things you should do, you know, so that it looks good on a CV or resume. But I think you need to explore those opportunities to make sure too that medicine is right for you. Because again, I say it to other, pre-med students to make sure if there's something that you're just as interested in as medicine, or just like when you're in the medicine track, something that you're just as interested in as surgery, make sure to really strongly consider that, because being a physician, also being a surgeon, requires a certain kind of personality, work ethic, dedication, that you want to be, all or nothing. Again, it's okay to change your mind down the line, but it requires that kind of commitment and focus, and that it really fits you. Like, not to do medicine because of, you get paid a certain amount, or because of the prestige or glam or anything like that. Because at the end of the day, you're going to have to make these certain kinds of personal sacrifice, whether I have to pick my patient over spending time with my family. That comes a lot. I think too, in high school, what can help is, I think it. I think starting as I was in high school, it doesn't hurt to have, as I mentioned, other interests. Whether it's, you have a passion for service, for volunteering, or you enjoy playing a certain sport, to show that you have a certain commitment to one. A couple. You don't have to have, you don't have 20 things on your CV, but to show, that you have these other interests outside of medicine. You might have some leadership opportunities through it. I think it shows a mature sense that you dedicate time to have other passions outside of medicine. And I think it will help you in the long run to be a well-rounded physician, and more balanced physician. And also too, that's something interesting for you to share in your upcoming interviews than just, oh, let's talk about my ER shadowing, or other pre-med requirements. Um, do you have any recommendations for what we should look for in medical schools if we want to go into plastics and reconstructive surgery? Um, I think for medical school, you want to make sure, if you can, that they're linked, with a hospital, or opportunity, that they have a strong program in general surgery. I think is valuable, because regardless, you want to know if you're going to be a surgeon or non-surgeon. Because too, you want to think about a backup plan, especially if you can't match into ENT or plastic surgery. So a strong program in in general surgery, and then also too that there's divisions or departments in ENT or plastic surgery. That way that you can get the best exposure with rotating, and then two, have an opportunity to have to get letters of recommendation, to be able to involve in research. I think those are helpful. They're not requirements, but I think the hurdles or obstacles are much higher, or difficult, if you're at a med school where they don't have, a plastic surgery program with research. Something to just take into account, but this is more on the, residency level. If it's an ENT or plastic surgery, group in academics, and they're only a division, then they may not just carry as much weight or have as much autonomy compared to being their own department. Just something to think about. If you got to do it all again, what would you choose to go into plastic surgery again? I definitely would. I think for me, it not only has met just my passion of, for my own inspiration from my childhood experiences, but also me as a person, of being meticulous, detail oriented, wanting to work with my hands. I think more for me of how I could do things again. A couple things: establish, um, a kind of better discipline in terms of studying to do the best I can in terms of testing. I think going through high school and undergrad, doing well in school came naturally to me, especially if I needed to, cramming a couple of days before a test to be able to do fine. The MCAT was, I think, my most difficult test, where it hit me that I just didn't do as well as I should have. When you are in that higher tier of individuals, where it's applying to med school and eventually residency, you know, I realized soon I just wasn't a great test taker. There's just those individuals that are with you that, even if they don't study that much, they can do great in tests. And so I inherently had to learn how to be a better test taker. I got, some formal help with that in residency. If I had to do it all again, I think just to, um, I'm not the best at investing time to studying either, just with my study habits I developed, through high school and college. So that is something would have thought consider. And then, this is more from a professional goal standpoint. I realized applying for jobs that I wanted to be majority facial plastics as much as possible. But for me now, again, a couple of years in practice, I wish, if I had those opportunities there to pick the job where I could have been more surgically busy to begin with. I was with a dermatology group, and after less than a year, it didn't work out. It's okay. Sometimes it happens. So for me, I'm still trying to hustle. I do a lot more non-surgical, but whether it's just to get that gain that experience and that confidence sooner, I think it helps sometimes to be operating more so in the beginning, even if I'm not doing cosmetics as much from the beginning. What experiences did you have as a pre-med that helped you get into med school? Anything that you found increased your chances? What would you recommend to a freshman in university? um, so I think, kind of similar to what I was expressing for advice for high school students, um, in for to get into medical school. So of course you need baseline grades, and then your test scores, right? Your MCAT. I think it's helpful to really, align quickly with your pre-med advisor, even as early as a freshman, to go and meet them so that they know you, they have you on their radar, and just to touch base and say, okay, requirements, these are my grades, what are your thoughts, like, of what I should be doing, because they're going to be to give you the best advice. I'm much further removed now. For me, thinking about MCAT and applying to med school seems so long ago. So it's your pre-med advisors and the peers ahead of you who've applied to med school, who are your best resources of what you should or shouldn't do. And then I think it's helpful to have research, to get in the lab, or, to go work at places like NIH in the summer to get some experience, but also hopefully to see a project through. Not like worked on 10 different projects, but it's okay if you only have a couple projects, but then you get to where you are able to present it at a conference or do a paper or to be involved with writing up the protocol. I think that shows initiative and commitment, from the med school side for admissions, to see what you've done or not done. I think if you are able to, include some more medical related experiences, whether it's being a scribe, volunteering, working for, raising money for medical nonprofits. As I mentioned, I think doing medical mission trips is awesome. I feel like more and more applicants are doing it now, so it doesn't seem as unique compared to when I applied to medical school. Um, but I think those, regardless, always think about, yes, you need to do certain things to help your CV, but do it for yourself too, so that you can, make sure for yourself, is this what you want to do, and also to, whether it's to help cultivate your passion or interest. Like for me, it was an idealism of service. And then two, always make sure and to think whether it's at the surface level, to make yourself seem more interesting, so you have something more to talk about than just medical related topics, or to make you that more well balanced applicant and eventual physician. you know Major in or minor in that major, that whatever other subject that you always wanted to, if you have the time, go study abroad, go travel abroad, or go whether it's you want to join a sorority or, volunteer in some other capacity. I think you never know whether there's connections that may help you later for applying to medical school or just to make you more, a well-rounded applicant because everyone else is going to say, hey, I spent this many hours, shadowing at this hospital, right? Everyone's going to have that. Maybe everyone already has medical mission trips under their belt. But just to and also that keeps you staying true to yourself because at the end of the day you only go through high school and college once, so make sure too that you're enjoying it, that you're because even later on it's such a narrow journey with medicine. You don't want to just do medicine. You whatever you do outside of medicine is going to help make you be a better doctor regardless. um, and I think I just had additional question, but I'll just open it up. I had a private question. What was the type of job you had mentioned we should do over the summer? So over the summer, again, if you want to go like do an abroad program over the summer, do it because especially if you plan to go straight through like I did, you may never get to travel. I ended up after my fellowship, my now husband and I, we spent 5 weeks in Europe and then we got married and did a 2 week honeymoon. I'm glad I took that time off. I wish I took more time off before my first job because you never get that time back, especially with medicine and then raising a family and such. The jobs you can do, so you can look into doing research. Like I live in the DC suburbs, so I worked at NIH for a couple of summers. Or you could, stay on campus at your college to do research. You could, again, if there's a summer abroad program, study abroad in Europe, wherever, go do that. Or if, there's another kind of research program, or just if you just feel like you need to take time on and you just want to, work at whether it's your college admissions office, you want to do Habitat for Humanity. Like I think that is, that's okay. That's more than okay. It shows that you had a certain passion, you took the initiative to do something, you have a passion for it. I think that still matters, regardless. Um, so these are all like great questions. I think I know we're kind of approaching the end of the hour. Are there any other questions that you all have at this time? Okay. And I think, I don't know, Michelle, are you still there? I know
Yeah.
you're still a little frozen. Okay, perfect. So what I'll do is I'm going to just share my Instagram handle again, DRTINAHO, and then also my email address. So I'm happy, to, one-on-one communicate with any of you, with any other questions, whether just send a DM or email. Again, I'm grateful for any support in terms of following Instagram. And that's just kind of day to day to see more of my before and afters of patients, my perspective on as a female surgeon, a mom surgeon. And again, really appreciate the opportunity for you all to be here. Hopefully this was helpful. Hope you learned something. And again, just think of medicine as a journey. It's great that you guys are interested in medicine, and I definitely think if you have the right interests and this is for you, it's a very rewarding profession. And I definitely enjoy, my husband, he works to live. I unfortunately right now live to work. And that I think it's unique to be able to enjoy what you do, and that there's always something to do with what I with my profession. So um, sounds good. Okay, so thanks so much again for all your time, and again, for Michelle and for the team for having me here. And hope you all are doing well and have a great week.
Thank you.
Yeah.
Thank
Take
you.
care.
Thank you.
Have a wonderful day.
Take care. Bye.
Thank you.